My name is Bill Ledger. I'm Professor of Obstetrics and Gynecology at the University of New South Wales, and I'm the Director of Reproductive Medicine at the Royal Hospital for Women. I also have a private practice at City Fertility Clinic in IVF. I've been asked a series of questions by Anya, and I'm more than happy to share my knowledge about the issue of funding for IVF in Australia with you. I've been working in IVF here for over a decade, so understand this quite well. I've also been a chair of a working party for the government in Canberra, looking at the appropriateness of Medicare funding for patients with fertility problems, advising government on how this should work. However, my practice has always been based in New South Wales, so this might be an eastern state biased presentation. Do keep in mind it's important to look at your own individual circumstances, work with your GP, work with your fertility specialist in order to work out the costs and charges that will come from an individual clinic in whichever city you live. So the first question is, what is the cost difference between private and bulk bill clinics? Well, let's start by saying that Medicare is an extremely good system for reimbursing costs of healthcare, whatever the problem you have, not just in infertility. It's highly preferable, I think, to the American system, which works well for the wealthy, but less good care for those who are not well off. And it works better than National Health Service in Britain, where I worked for many years, because we really do avoid long waiting lists and underfunded treatments. Medicare is a good compromise between private and public, and it's something we've worked with for a long time and we know works quite well. So Medicare is the basis of the funding of all the IVF treatments we provide. It will reimburse $4,000 to $5,000, depending on the nature of the treatment, for IVF-related services. And so bulk bill clinics more or less can run within that constraint. Often they do have to add a certain cost because in order to run a good service, it might cost more than Medicare is able to provide. But those add-on costs should be $1,000 or less. The private clinics do offer a higher quality of service, and we'll talk about that in a moment. But the cost of an IVF out of pocket after Medicare rebate might be anything between $5,000 and $7,000 per cycle. It's important also to dissect this slightly more and to say that these are the costs of an IVF cycle, usually with ICSI, which might be for male infertility with a small extra cost. But if embryos are frozen, there may be a storage charge for frozen embryos, anything between $250 and $600 or so per 6 months or per year. And then the cost of a frozen embryo transfer does have a Medicare rebate, but there will also be an out-of-pocket cost of anything between $1,000 and $2,000 or $3,000 for each frozen embryo transfer. If there's not a pregnancy from one cycle of IVF, you have to go around again, and then the cost will mount up. So when budgeting for this, it's wise to consider the cost of 2 or 3 cycles of IVF rather than just, if you like, putting all your eggs in one basket for one cycle. Who is and who is not eligible for bulk billed clinics? Well, there are a lot of bulk billed clinics across the country, some run by the big private providers, others independent, and others like ours here at the Royal, and a few other clinics around the country, more publicly focused and based within big public hospitals. The services eligible and the patients who are eligible will vary. Mostly the bulk bill clinics like to focus on younger, less complicated cases. If someone comes with a particular complexity, they will probably not be interested. They're usually not able to cope with patients who have comorbidity, who have a health problem on top of their IVF, because they don't have high quality anesthetic safety as we would see in a big hospital when they're doing egg collections in a daycare facility that's not part of a large hospital like the Royal Hospital for Women here in Sydney. Sometimes there will be an age cutoff. In our own clinic, we don't offer treatment for the low-cost fertility model for women over 41 years of age because the statistics about chances of a healthy live birth are slim, and our government funding requires us to offer treatment for high-value care, which we decided to set at a level of less than 5% chance per cycle of a healthy baby. So that's a cutoff that's applied here. They vary in other clinics around the state and around the country. Where are the clinics located? Well, there's a great variety of providers these days. If anything, in the big metropolitan centres, Brisbane, Sydney, Melbourne, perhaps Adelaide, Perth, There may be too many clinics at the moment because these are big commercial operations that are profit making. And there is good money to be made out of providing services for IVF at the moment. So it's important to shop around, use your GP, maybe use your gynecologist or fertility specialist, get their advice, get their knowledge, look at the reports back from other patients that are available on the internet, take soundings from people, talk to friends or colleagues who've been through the IVF process and get a feeling for the clinics that are interested to provide care to you. And perhaps after you've finished your own treatment, provide some feedback yourself on the web so other couples, other women can read that and get an impression about quality, because it does vary. If you go look at the My IVF Success website, which we run from University of New South Wales, you will see the variation in the pregnancy rate per cycle across different clinics in different parts of the country. And those numbers are quite interesting to look at. How do billing clinics keep their costs so low? By keeping things simple. Not having much doctor time. Doctors are much more expensive to employ than nurses, so often it's a nurse-provided model. Now, that's not a bad thing. Well-trained and appropriately qualified nurses can replace doctors in many situations in medicine, and they certainly can in the world of infertility. But as I said earlier, if the problem is more complex, if there are medical comorbidities, if there is a difficult egg collection, a difficult embryo transfer, planning to be made with other specialties, then that's where clinical input is needed. And it may be that a bulk bill clinic is not an appropriate place for people who are not healthy, young, and just needing IVF in order to have a child. What differences are there between private bulk bill clinics in level of care? Well, as we've just spoken, I think the amount of doctor time is important for some patients, but not all. Also, if patients or partners are particularly anxious and need some personal care, often in a private clinic, you'll have the same doctor throughout your care. That's not uniform, but certainly I think it's a quality issue. If you're paying a significant amount of money, you should have a good professional relationship with your doctor, who ought to be able to look after you more or less through the whole cycle. Obviously accepting that everyone has to have time off for holiday, for study, for attending conferences and keeping up to date. None of us can work 52 weeks a year, but taking that on board, I do think some of the higher quality clinics, higher cost, is associated with a more personal service and more individualized care. Are there any limits to the number of cycles you can get bulk billed? Short answer is no. Medicare is very generous. There is no limit to the number of cycles that Medicare will fund. There's no limit to the number of cycles per year that Medicare will fund, and the second and subsequent cycle per year attracts a slightly higher Medicare rebate than the first cycle. Additionally, Medicare does not have an age cutoff for women or men, so Medicare in theory will fund women in their 50s or even 60s if they want to do IVF, even though the chances of it working are zero. Do you offer other services besides IVF? I do think this is an important point of departure, that a fertility centre is not only about IVF. The practice here at Royal Hospital for Women, we offer a whole range of services for ovulation induction, for reproductive surgery in some cases, using medications such as Clomid, letrozole and FSH where necessary, intrauterine insemination. All of these are more gentle and less taxing approaches to fertility care that don't involve IVF. The important thing is to have a sensible discussion and sensible investigations with a clinical team to work out what's the right approach for an individual patient and individual couple, because every couple are different in terms of the problem they present. And I do think it's important that we don't resort to IVF for everybody. It may work, but often it's quite taxing for patients, especially for the woman who does most of the work in IVF, to go through a cycle. And so if we can avoid that stress, avoid that pressure, it might be preferable in quite a number of circumstances not to do IVF, at least in the first instance, and try something that's more simple first. Is there a wait list? Well, as I speak, we're struggling with the COVID lockdown in New South Wales, and that has put treatments, certainly slowed them down, and in our own centre put them on hold until the lockdown is finished. Most of us try not to run a long wait list because we know the negative impact on the woman's fertility, particularly of having, as they get older and aging, particularly after 35, has a big negative impact in the chance of IVF working. So most clinics will see you quite quickly. I know that in some cities and some towns there are not many IVF specialists, and those that are there tend to get booked out well in advance, so there might be a delay having that first consult. But usually once the consult happens, the treatment can begin fairly quickly. And again, it's something to work out and look when you're comparing clinics and decide which one to go for. Look at how quickly you can be treated as one of the factors that might influence your decision. And then finally, are there low-cost clinics accredited for kosher IVF? Yes, there are. We have accreditation here at Royal Hospital for Women, for example, but there are many other clinics that the Jewish Fertility Network can advise you about around Australia that are accredited for kosher IVF. We're very pleased to be able to help. It's something that we like to do. We respect hugely the needs and wishes of all our patients. Kosher IVF is not a difficult thing for a lab or a clinic to provide, and where it's required and needed by the couple, it's really a pleasure to help to provide that. And that's something that you'll hear from many IVF clinics and many IVF clinicians.